Alright, my presentation is on the new Boston Public Health Commission regulations concerning the use and sale of tobacco. In December 2008, the BPHC passed some new regulations. They went into effect in February of this year, 2009. So, among the regulations, there are regulations on the sale of tobacco. Healthcare institutions and grocery stores with pharmacies in them can no longer sell tobacco products. They feel this is somehow a conflict of interest. Educational institutions also can't sell tobacco products. The rationale there is that when their mission is to teach, and children should not be sent the message that tobacco is okay. Also, blunt wraps can no longer be sold in Boston. They also impose some new regulations aimed at the workplace. Smoking is banned in hotels now, which eliminates smoking rooms. Smoking is also banned in outdoor spaces that are adjacent to indoor spaces, like loading docks and restaurant patios. These are about limiting the exposure of the people who work there. In hotel rooms, somebody's got to come in and clean the hotel room. That worker is exposed to secondhand smoke. Also, the smoke can pass through the ventilation and get into non-smoking rooms. And in outdoor spaces that are adjacent to indoor spaces, the smoke can waft in and get stuck in there, I guess, is the rationalization. There are also new regulations for smoking establishments. These are places that are specifically geared towards customers who want to smoke there, like cigar bars and hookah bars. These bars must now post signs detailing the risks of smoking tobacco. Also, no new permits for smoking bars in Boston will be issued, and all smoking bars are required to close within the next 10 years. They're banning the smoking bars, but they're giving the existing ones some time to get their affairs together. Of course, this all hinges on the health effects of secondhand smoke, and specifically secondhand smoke in the type of situation that these regulations are designed to address, like smoking on loading docks. You can come in the big doors and get into the lungs of non-smokers. This, of course, only matters if secondhand smoking affects people like smoking does. It affects their health, and a 2006 report by the U.S. Department of Health says that it does. And B is getting into people's lungs in sufficient quantities to pose a health risk, and that is a little bit shakier. This is a chart that from that same 2006 study that I mentioned, that talks about the decay of airborne materials, or elimination of airborne materials from smoking, based on air exchange rates. Now, This chart is aimed at regular secondhand smoke indoors. There are people smoking in a room, and somebody across the room inhales the smoke. So, depending on how well you're ventilated, it determines how quickly the smoke gets out of the air system. Now, when you're talking about what we're talking about, which is outdoor areas that are near indoor areas, they don't really have that data that's geared towards that. I imagine that kind of data would be pretty hard to come by, considering the huge difference wind would make, for example. But this would apply directly to the smoking in hotels, for example. So, as you can see, if you have a whole lot of ventilation, the smoke is not really staying around for very long. If you don't have much ventilation, it's staying around for a very long time. So the issue in whether or not it's going to hurt people's health is the ventilation. So the smoking in the outdoor areas, the evidence that that would give enough exposure is kind of shaky.